So we're here today with Debbie, and we are going to be doing something a little bit unusual, something that we don't do every day for her in the next couple of days. We're actually trying to correct a problem that she got as a result of prior cosmetic surgery. Debbie went and had a coronal brow lift. An incision was made from one ear all the way across the forehead to the other side to be able to shorten the length of the forehead while effectively giving her a brow lift. They were a little too aggressive with the amount of skin and tissue that was removed, and as a result, everything got shortened too much. If you look at the distance between her hairline and where her brows sit, it's approximately 5 centimeters all the way across, which is significantly lower than what she wanted. For many patients, somewhere between 5 and 6 centimeters is a normal natural length of the forehead, but in Debbie's case, especially kind of set in the center here, it's just a little too short for her. And you can see that her brows on the sides have also been pulled up significantly if you compare that to her before photos from this procedure. She's left with a scar that is very flat. That's unsightly for her. She's left with brows that are a little too high that make her look more excited than she'd like to. Now we are planning to correct this, and that requires effectively lowering her brows and increasing the length of her forehead, which is overshortened. And in order to do that, we're going to do it in a two-stage procedure where initially we're going to put in a tissue expander, which is kind of like a balloon that you slowly inflate with saline underneath the skin of the forehead. And over the course of a month or two, we're going to slowly expand that, and that's going to stretch the skin so that we'll have more skin in the forehead that we can use to push up her hairline. And once we've recruited enough skin and expander enough, then we'll go back for a second procedure where we take out the tissue expander and then we contour and put the skin back where it's supposed to be, while at the same time raising her hairline and lowering her brow. So it's going to take a couple of months for this process, and Debbie has the best attitude because she knows what she's going to have to go through. It's going to look kind of funny with this expander underneath, but she's prepared for it because she knows in the long run she's going to look better and more natural. She's going to be happy with the results.